Welcome to the Alberta Health Services video series on helping you feel better after COVID-19. This session will cover how to exercise at the right level and how to monitor your symptoms. It's expected that your rate of breathing will increase when you exercise, and you'll normally take deeper breaths, but it's important to be able to tell if you're exercising at the right level for you. To know if you're exercising at the right level, think about speaking a sentence, also known as the talk test. If you cannot speak at all, or can only say one word at a time, or are feeling short of breath, you're working too hard. If you can speak a full sentence without stopping, it's too easy. You know you're working at the right intensity if you can speak a full sentence, pausing once or twice to catch your breath, and are moderately short of breath. You should not feel short of breath when you start an exercise program after recovering from COVID-19. If you do feel too short of breath to speak, you should slow down or stop to rest until your breathing feels more controlled. You may need to lower the intensity or reduce the time of your exercise. It's most important to watch for post-exertional symptom exacerbation, which tells you you've pushed yourself too far. There are other tools that you can use to rate your intensity, and we'll touch on these in the following slides. Many people think that after their initial illness, they can jump right back into their regular activities, but this doesn't seem to be the case with long COVID. Often people start to feel worse and have difficulty gauging how much activity is okay. Using a symptom tracker can be one way to gauge if your symptoms are worsening with activity or exercise, and can indicate that you need to progress more slowly or add more breaks throughout the day. Another way to monitor your exertion is to use a heart rate monitor. Many fitness trackers or wearable technology have heart rate monitors built right in. A safe recommendation to start is by using your resting heart rate value and adding 15. Start slow and gradually increase your heart rate. Rating your level of exertion using a tool like the Borg Scale is another way to track your intensity of not only your exertion, but also your symptoms. This is the Borg Scale. It's a rating of perceived exertion scale, and it has two sides on it that you can rate how hard you're working, your exertion, as well as pay attention to how you're feeling, or your symptoms. It's important to note that when you're recovering from COVID-19, you should be tracking your symptoms as you're exercising to ensure that you're not overdoing the exercise. All tasks can cause fatigue, including physical, cognitive, and emotional tasks. Ask yourself, are you experiencing post-activity crashes? What activities are you doing? How do you feel immediately after you do an activity or exercise? And how do you feel the next day or beyond? These questions will help determine if you need to pace. There are a number of ways to pace during exercise. You can adapt by doing fewer repetitions or choosing different equipment. You can alternate by doing seated or standing exercises, upper and lower body exercises. Start low, go slow, and gradually add time, resistance, and repetitions. Exercising safely is important, even if it was part of your routine before coming sick. If you exercised regularly before coming sick, you may find that you're not able to resume what you did before, and you might need to make some modifications. It's always important to listen to your body. So if you're experiencing an increase in your symptoms, slow down, cut back, or stop. You may need additional guidance if you weren't exercising regularly prior to getting ill, if you have difficulty with your mobility, have experienced falls, or you have a chronic health condition. It's important that anyone on additional oxygen talk to a healthcare provider before starting to exercise. If you feel any of the following symptoms, do not exercise, stop exercising, and contact your primary care provider. It's important to note that none of these symptoms are a normal reaction to exercise. If you have any new symptoms of chest tightness or pain, a racing heart rate, or you feel faint, you should get medical clearance from your physician. If you are experiencing a medical emergency, don't wait, call 911. Recovery from COVID-19 can be different for everyone. It's important to contact a health professional, such as your primary care provider, a rehabilitation or recovery professional, if you're experiencing any of the listed symptoms post-exercise. New or worsening symptoms, significant swelling or a red-hot joint, difficulty managing your daily activities, breathlessness that doesn't resolve with rest or self-management techniques, pain, numbness, or weakness that makes it difficult to move or results in falls or affects your normal function, troubles increasing your activity, or you feel worse after exercising.